So good morning, everyone. Welcome to the online Golden Age Summit organized by the Golden Age Foundation. I'm Herman Chan, the Executive Director of Alphavy and your facilitator of this section, From Crisis to Changes. I would like to first take the opportunity to express my greatest gratitude to our honorable keynote speakers, Dr. Caroline Smith, Dr. Karen Eggleston, Dr. Adrian Hayter, and Professor Marvin Formosa. Due to time difference, all videos were pre-recorded, but I'm sure that all of us have been truly inspired by your invaluable insights on how the global community can join hands together to overcome the challenges of aging population. So now let's focus back to Hong Kong. How has Hong Kong been doing recently in response to this crisis? Can Hong Kong learn from the success from our overseas counterparts? Today, we are very honored to have two expert guest speakers joining our panel discussions. They are Professor Peter Yuen, the Dean of the College of Professional and Continuing Education, the Hong Kong Polytechnic University, and Ms. Maira QAMAR, Policy Researcher of our Hong Kong Foundation. Let us first invite our guest speakers to present the recent research, followed by a panel discussions to explore solutions to help Hong Kong overcome the crisis of COVID-19 pandemic and aging population. For all online audiences, please feel free to submit any questions you have for our guest speakers using the Q&A functions of the Zoom platform. I will then bring up some questions during the panel discussion. So may we have our first speaker, Professor Peter Yuen. Peter, please.
Sorry, maybe I was muted before. Thank you, Herman, for the introduction. I'm delighted to be here to share some of my views on long-term care in Hong Kong during the pandemic and beyond. My own background, I'm a health economist, like the speaker, Professor Eggleston. I am interested in the money side of healthcare, of care in general, how we should pay for different types of care, who should pay, how should we pay the doctors, what type of grant should we use, and things like that in order to achieve the best outcome. So I would also focus my talk more on the money side of things, if you would bear with me. But I do feel that money is most important. Without it, I think even though we have great ideas, we cannot do them. So maybe let me try to share my slides here. Right, can you all see the slide? Okay, great. So I'm going to sort of do a very brief assessment of long-term care in Hong Kong before and during, and also after the pandemic. What needs to be done? I think we should all agree that there are serious long-term care problems in Hong Kong. And the problems have been very serious even before the pandemic. There are problems in terms of quality. There are problems in terms of sustainability. And our system almost collapsed during the fifth wave of COVID-19. And we all, I guess, are very sad about this. I think major reform is absolutely necessary and urgently needed. This is some homes you see in Hong Kong. Do you want to spend the last years of your life in these homes? But unfortunately, a lot of our residents do spend the last years of their life in homes like this. We are actually a high income region our per capita GDP is higher than UK, is higher than Canada, higher than Japan. But if you go to these places and visit their long-term care homes, they are not like this. How come we as a society continue to tolerate conditions like this? Well, problem number one is that we have way too many of our elderly people in residential homes. So if you look at the percentage, the percentage of our elderly population currently in residential homes, then we are one of the highest in the industrialized world. We are, 3 times that in Taiwan. We are double that in Singapore, more than double that in Singapore. So it's not desirable to have so many of our elderly patients institutionalized. It's much better for them to continue to live in the community. And there are some studies that shows that 65%, so the majority of those applicants to residential homes really do not need to be institutionalized if you just look at the physical health. But of course, there are social reasons in Hong Kong for that. But they can receive care in the community, I think, at a lower cost and much better quality of life for them. So because there's so many people wanting to go into residential homes, currently there are about 40,000 on the waiting list. And the waiting time is, 29 to 41 months for subsidized homes. And every year, more than 5,000 persons on the waiting list pass away before they actually got placed in a home. Problem number 2 is that the subsidized residential places are grossly inadequate. The subsidized places have a much better quality. They are, halfway decent. They are still not ideal. I wouldn't want to live there. But compared to the other places, I think they are still better. But the number of places being offered are grossly inadequate. So if you look at this chart, only 26% of all the residential home places are subsidized by government through the direct subsidized schemes. Then there's the so-called bought place schemes, Maira QAMAR, which is a little bit better than the non-subsidized places. Those I've just shown you are probably non-subsidized homes, the 2 pictures. So I think the better homes are grossly inadequate. And also community and home care services are grossly inadequate either. Currently, there are over 10,000 people on the waiting list for subsidized community and home-based care. Average waiting time is over 30 months. One study has estimated that we need 225,000 home care service places, but currently we're providing only about 30,000 places. So that is the status of home care and community care. The 5th wave of COVID has magnified the problems. The problem we see is that 90%, almost all the residential homes had outbreaks. And then 10% of all the residents died during the 5th wave. This is totally unacceptable. The hospitals were overwhelmed with patients waiting outside in the cold. We saw these scenes on TV, which is totally unimaginable for things like that to happen in Hong Kong. And our mortality rate from the 5th wave is the highest in the world, We have been doing so well previously, but with the 5th wave, we were the highest in the world. And then 60% of all deaths were residential home residents. So there are about only 60,000 residential home residents in Hong Kong. But the number of deaths, the rest of the population is over 7 million, but over 60% of all deaths comes from residential homes. So that is an indictment of the quality of care that we have in Hong Kong, in homes as well as in the hospitals that they were sent to later on. Now, I always focus on money. So all these things happening, I think is totally understandable if you look at how public money is spent in Hong Kong on care. So all the money goes to acute care. So you can see this chart here, about 90% or 80-some% goes to public hospitals. And then primary care receive maybe about 10% of what hospital authority gets, and residential, long-term care, and community care, much, much less. So that's why we have the situation. If you don't invest in long-term care, then of course you would have all those problems that we have seen in Hong Kong. And not only that, the money is compartmentalized. So you have, healthcare bureau responsible for healthcare and hospital care, and then the long-term care under Labor and Welfare Bureau. They have separate budgets, separate governance systems. The money don't mix, even though it makes sense to maybe divert some resources from hospitals to long-term care institutions, but it's not, it's not their jurisdiction. So it's not my problem. So it's Labor and Welfare's problem. They need to find money to do it. And so let's look at the long-term care financing equation. So we economists are not comfortable unless we can express things in terms of an equation. So the left-hand side are the so-called sources of funds. So taxes, health insurance, user fees, donations, these are the possible sources of funds for long-term care. And in Hong Kong, it is financed primarily by taxes and users fee. We don't have long-term care insurance. Medical insurance would fund very little. Maybe it's for a small part of long-term care, maybe for the initial couple of weeks or so after you get discharged from hospitals. But in general, they don't do much. So we rely heavily on taxes and also users out-of-pocket payment. The other side of the equation would be the uses of funds. So if you cannot increase the sources of funds on the left-hand side, then you would look at prices and quantity. Prices means that we might have to lower a certain price in order to deliver the care, or quantity. In Hong Kong, of course, we are limiting the quantity. So that's why you have this huge waiting list. Now, if tax is the major source of funding, we are in trouble because this is the demographics. The projected labor force is coming down. So these are the people who will be paying taxes. They will pay salary tax and etc. So ever since 2018, our labor force has been on the decline, and the decline will sustain. It will not get better. It's not a short-term thing. It will be a long-term thing. So where are we going to get extra money? We have more people retiring, fewer working people paying taxes. Another source would be if we have economic growth, then of course government would have more taxes, and then you could fund more services. But this is not looking good. The whole world economy is contracting. And so Hong Kong is no exception. So previously we enjoyed high rate of economic growth, and yet we have all those problems with long-term care and medical care. And now with deficit government budgets, do you expect government to put more money in long-term care? So where is the money coming from? So the government's budget is now a deficit. All these years we see government surplus budgets year after year, but now we're experiencing government budget deficits. And we have no alternative financing schemes in place. Our neighbors, Korea, Japan, Taiwan, Singapore, have all implemented mandatory long-term care insurance. And Chinese mainland have also initiated long-term care insurance pilot schemes in 29 cities. And I think they would probably roll out the mandatory schemes very soon, if you know the style of the Chinese government. And last time long-term care insurance was discussed was in 1998, the Harvard report. And then there were no follow-ups ever since. So my recommendation is that we really need to reduce the more expensive residential care and expand the community and home care in Hong Kong. That would be much better for for the elderly persons staying at home, and would be cheaper as well. In residential care, you need 3 shifts of staff, so they are forever shortage of staff. But if it is community-based care, 1 shift, okay, if it's home care, it's only a certain amount of time using the staff will be there. And then we really need to integrate health and long-term care, shift some money from acute care to long-term care. And by integration, we really need true integration. True integration means 3 things. 1 is funding. Number 2 is governance. Number 3 is staffing. So unless you have all these 3 things under 1 roof, you're not going to get integration. People will talk about it. People will say, yes, yes, we will coordinate. We will try to integrate. We will have meetings between bureaus, but nothing happens. So things can only happen if all these services are put under 1 budget and they report to the same minister. And it's the staff, you can also redeploy staff to go to long-term care institutions from acute hospital. You can deploy physiotherapists, you can deploy nurses, you can deploy your healthcare assistants there. Because right now, they are forever in shortage. Once you hire a nurse, when there's a vacancy in hospital authority, they leave immediately. So because those are dead-end jobs for them. But if you integrate them, then you can deploy and they can take turns. And the third thing is we really need to start exploring alternative long-term care financing source, which is the long-term care insurance. Studies have shown in the mainland, the pilot studies, that after they have introduced long-term care insurance, outpatient medical expenses for those elderly persons with long-term care insurance actually reduced by 24%. Inpatient expenses reduced by 20%. So it's not having extra burden. You will actually save money from medical care if you have proper long-term care services. And actually the ADL, activity of daily living, of those insured actually improved after long-term care insurance was introduced. So recently, if you want to know more about those, a book I've recently published by Routledge 2022. So I'm doing some advertisement here. And these are some of the other references about long-term care in Hong Kong. So that's all I have. I would stop here.
Thank you, Professor Yuen. There is indeed great urgency to reform our long-term care system to avoid another painful crisis from happening again. So may we now have our second speaker, Ms. QAMAR. Maira, please.
Good morning, everyone. So thank you, Herman, for the introduction. And as mentioned by Herman, my name is Maira, and I'm a policy researcher at our Hong Kong Foundation. So basically, OHKF is a think tank, and we do policy research work on land and housing, healthcare, aging, and also Geron technology, which is a topic and some of the research findings we have done recently, which I will be sharing with you guys today. But before I start my presentation, I really do want to extend my thank you and my gratitude to the 7th Golden Age Expo and Summit organizers for, putting together such a meaningful event year after year. So, I'm really grateful to be here, and I'm grateful for such a meaningful summit. So I'll share my screen right now. Can see, okay. All right, and before I sort of talk about, Geron Tech and what it means to Hong Kong in Hong Kong setting and for the elderly here in Hong Kong, I really want to set the stage, and I think Professor Yuen was also mentioning a little bit about the population structure here. And as you know, Hong Kong, perhaps in 2013, they recently got the title of having highest life expectancy, surpassing Japan. And with this sort of achievement, we also know that, our future is sort of questionable in terms of our population structure. But really what was something that was worrying us was not so much, the aging population that growing, but more so also, the decline in our labor population. So we have this sort of projection. I'll just move the text box so you can see of 2069, and you can see really in that middle area, we see such a sharp decline in our younger population. So that means that we have, less people to support the growing aging population. But, obviously, as Dr. Schmidt pointed out, we need to start shifting our mentality away from thinking about elderly as merely like recipients, idle recipients of, social care and welfare, and really to start thinking about how can we empower them, how can we make them more active, citizens, especially if they will be making the most a majority part of our society in the future. So when we think about, the topic of gerontech, most people think about, okay, what do we mean by gerontech? But by definition, there really isn't, a universally agreed definition. But the way we try to explain it to people, it's simply technology made for the elderly to help them in the different facets, the different challenges that they face during old age. And the first thing that sort of comes to people's mind is that, are we talking about care robots? But it doesn't necessarily need to be something as advanced as robots. It can be something as simple as an electric wheelchair or a health monitoring device. But something that really surprised me and really brought me a little bit more hope when we were doing our research on gerontech is that it's able to somehow also help the elderly or caregivers navigate our more outdated healthcare and social systems. Because as you know, like Hong Kong's population is aging population is rapidly advancing, but our healthcare systems and our social systems aren't able to almost keep up with these changes in not only aging population, but the demographic and the disease changes and the transition to more non-communicable diseases. So because our systems are taking a little bit longer than we hoped, gerontech is quite useful in this way. So let me give you an example. Let's say we're talking about primary care. And when we look at Hong Kong's health-seeking behavior, this might also be similar to a global phenomenon. But in Hong Kong, the health-seeking behavior is very hospital-centric. So if you have a problem, you go straight to the accident and emergency department of your hospital, and you wait a couple of hours and hopefully get checked. But there's not really this sort of prevention mentality, management of chronic health condition. And so gerontech products like health monitoring devices, they can be used to, really manage chronic health conditions, especially for those who are at higher risk, and get them started in this journey to better manage their conditions. But this is in no way of me to say that, gerontech is solving our more deeper rooted issues or our deeper, healthcare issues or social issues. But at the same time, it's kind of giving us this support mechanism until we figure out or we spend time to resolve these more deeper rooted issues. And so at our Hong Kong Foundation back in 2017, we were quite interested in, learning more about gerontech, and we wanted to know, if there is any way we could invest into the aging ecosystem. And so we came up with our first gerontech report, and we looked at if there are gerontech products out there in the market, and what is the ecosystem really looking like? Are there gaps in the ecosystem? How can we improve it? How can we, strengthen it? And after the release of the report in 2017, we saw something very positive. We saw suddenly that, the government was very involved in a lot of the initiatives. We were seeing, initiatives across different bureaus and departments. But not only that, we were also seeing a lot of industry level initiatives. We were seeing initiatives by the universities, and they were also doing a lot of promotion on gerontech awareness. They had showrooms where they were educating the public on the different types of gerontech application. For the government, they even came out with this $1 billion INT fund. And basically what that fund is for is that it allows nursing homes to rent and purchase gerontech products. So after we saw such a positive synergy in the sort of ecosystem, we thought, okay, it's been a couple of years now, has the ecosystem improved? Are there any sort of gaps in this ecosystem that we still need to work towards? And are there any kind of recommendations we can make to the government? So when we did our more recent research, we came up with this sort of infographic, and we basically try and capture, what the Gerontech ecosystem would have looked like previously, in the present, and what we would envision it looking like in the future. So if you look at, say, this left-hand side of the graph, infographic, you can see, obviously we had not that many supply side players, and we didn't have that many demand side players. And by demand side, I mean, the elderly and also their caregivers. And if you see these little balls, they actually represent Gerontech products. So we had some Gerontech products, but not that many. And this funnel is very, very important in the sense that it kind of represents the connection or the mechanism from which products can flow from the supply side and demand side. And you can see that there are definitely so many cracks on it, because we did see that, the ecosystem had a lot of gaps. And after doing further research, after, engaging with different stakeholders, we saw that, at this present moment, the supply side had increased. We were seeing more people interested in making Gerontech products. And because of all the awareness initiatives that was occurring at the government and industry level, we also saw that, there were more demand side players, and the funnel was starting to improve. But with that all being said, and, even if the picture looks super rosy, I think, there is still a steep learning curve, and there is still skepticism towards Gerontech really, resolving some of our issue. And I think that's a very valid point. But at the same time, so when we do think about the future, we need to bear in mind some of the challenges that we have. And one of the things we really try to focus on is that funnel, and how do we improve and strengthen that funnel so that products can appropriately reach the right target audience. So you can see that, if we can strengthen the funnel by including elements of infrastructure, of investment and talent, then we can really make sure that, products can reach the end users appropriately. So because of time limit, I will just very briefly go over some of the, problems we encountered in these different levels, and also some of the solutions we put forward. And so for the first part, we'll discuss on supply side. And for supply side, what's quite important is like, you really need to think about, someone who's making Gerontech products. And, developing Gerontech products is so special because you really need to keep the target audience in mind, because you are making these products for the elderly or their caregivers. And so it needs to be super user-centric. And that means that throughout the different stages of product development, whether you're designing it, whether you're doing prototype, whether it's being launched in the market, you need to have some sort of communication loop with the end user so that you can really tailor make this product for them. And in Hong Kong, we heard from a lot of the suppliers that they were struggling with gaining access to end user feedback. And this was especially problematic for startups who didn't have direct access to end users. And so we always try and look at elsewhere for inspiration. We saw that in Canada, they did have a senior advisory panel for the organization for Center for Aging, Brain Health and Innovation. And that panel was doing so well in the sense that they were being able to give advice to startups on, ideas or product development. And this was really useful. And we thought, what if we have something similar at home? And the closest effort we have seen in Hong Kong is what we call Gerontech ambassadors. But their sort of job scope is really to act as KOLs. These are elderlies, and they basically are like community volunteers that try and raise awareness about Gerontech across Hong Kong. So if we can sort of upgrade that and also have a panel that could directly communicate with startups on Gerontech ideas, that would be extremely useful. And this really echoes with what Professor Formosa was mentioning, especially near the end of his speech, where he said, we need to start including the elderly more, and we need to be more inclusive of the elderly in our decision-making process, especially if we want to strive towards smart aging. And so when we look at demand side, we're talking about, end users and caregivers using Gerontech products. What we see in Hong Kong, the situation really is that, Professor Yuen also shared this information on the institutionalization rate. And obviously in Hong Kong, we have seen the government try to do a little bit more for the Gerontech ecosystem in the sense that they came up with this 1 billion INT fund. And the importance of that fund was to get people to start using Gerontech products, because we don't really have a culture of people buying or renting these products just yet, or at least at that time as well. So they came up with this fund, but the problem with this fund is that this fund only benefits the elderly that live in institutions. It's not really benefiting those elderly that live at home or in the community, which makes up a majority of the elderly in Hong Kong. So we wanted to really start thinking about, if we are always thinking about how do we get a product to an end user, we really need to think about accessibility. And Dr. Smith also pointed this out, that when we talk about accessibility, we need to make sure that technology is accessible to the elderly people so that they can sort of, improve on their learning and employment opportunities. So similarly, when we apply the same idea in Hong Kong, we really need to think about accessibility, and not just in terms of a one-dimensional thing, but we have to think about, are we having informational accessibility? Is there physical accessibility? And is there financial accessibility? Because we're talking about a very hard to reach population group. And so when we talk about financial accessibility, one of the suggestions we made is that, instead of coming up with a new fund, or instead of starting from the ground level up, why not leverage on voucher schemes? Because Hong Kong really is unique in the sense that we have a lot of vouchers, and we have a lot of vouchers, especially for the elderly. So what we did is we tried to identify 2 vouchers that would be the most suitable for the different types of Gerontech products out there. And so it could start to at least incentivize the elderly to try and purchase or even rent these products, so they can actually start to see the practical usage of these products at home. And so moving on to the next part, I will talk a little bit about the funnel itself and infrastructure. And, obviously I have mentioned that, awareness has become it has improved in the last few years as a result of so many of the initiatives. And we've been having so many great exhibits. We've had showrooms across Hong Kong. But the problem with this is that a lot of these showrooms or exhibits are only one-off, or they are in certain district only. And when we are talking about the elderly group, we want to make sure that they don't need to travel super far to access Gerontech, especially if we want them to uptake these products. So we really started thinking about, if we want to improve physical accessibility, we need to really start thinking about how can we really have all these showrooms across Hong Kong. So Hong Kong has 18 districts. So if there is any location that is can be distributed across Hong Kong, that would be great. And so we studied all the different, elderly healthcare centers in Hong Kong, and we thought, the district health center seems to be the most suitable choice. And not only because it was spread across the 18 districts, but because it also has it's more spacious, and it also has medical personnel. They are staffed, they have OTs, they have PTs. And then again, we don't want to treat Gerontech products as something, you go to this stationery store, you buy whatever you want. We want it to be slightly prescriptive. We want, people to be able to make have someone sort of support them through what kind of Gerontech products are out there and what would be suitable for them, because we're not necessarily talking about cheap commodities here. And so, our suggestion was that maybe we could come up with a Gerontech corner in the district health centers. They could act as, as a place for raising public awareness, and also for these elderly to go and use their vouchers to perhaps purchase or rent Gerontech products. And finally, I think no system is complete without people. And we really need to start thinking about talent when it comes to Geron Tech. One of the reasons, obviously, we want to think about talent is that, with the elderly, if we want them to, figure out how to get the right Geron Tech product, how do they install it in their homes, how do they use it, and how do they maintain it? This process can seem very convoluted or complex to the elderly. So if we have a person who can sort of streamline this entire process, that would be great. And in Japan, they're doing something similar where they have assistive device planners, and they go through, several rounds of training, and they really act as a contact person for Geron Tech. But if we want to encourage more young people to join this field, we need to ourselves start taking this profession or this area more seriously. So we thought that, okay, if we want talent in this field, we need to come up with a profession. We need to make sure that it's formalized and it's officiated so that people or young people can actually think, okay, I would like to be working in the Geron Tech field one day. So we propose coming up with, potential Geron Tech consultants. And we think that, if this sort of position can be certified by some of our vocational training councils, then it would incentivize young people to join the field. And more importantly, why we need to really reach out to young people is that so far a lot of our awareness is targeted at the elderly people. And the problem is, I don't know if you guys have ever experienced this, but with grandparents, they don't really like to spend money on themselves. And especially on a product that they don't know so much about, they won't spend that money. And so if our grandchildren are aware of, what Geron Tech is, what are the benefits, they can sort of convey that message to the elderly. And not just that, that's not the only role that they can play, right? They might even be future caregivers, or they might even in the future want to come up with, innovation or solutions for the aging population. So it's very, very important that we start to, expose the younger people to what Geron Tech is, what the field looks like. And we can do this with more, competitions in schools. We can have more Geron Tech related courses in universities. And yeah, we really need to start exposing our younger people to what Geron Tech is and its benefits. Thank you. And if you guys are interested in our report, so you can see there is a QR code on the screen, and we have an English version of our report and also a Chinese version of our report. Thank you. And I will stop sharing screen right now.
Thank you, Myra. So we'll now open the floor for discussion. So again, please feel free to drop us some questions using the Q&A functions of the Zoom platform. So allow me to start off the discussion with some questions for our guest speakers. So the first question goes to Professor Peter Yuen. So our keynote speaker, Dr. Adrian Hayter, he shared about the introductions of the integrated care systems in the NHS of England, so which is a huge success. So do you think this is a role model for Hong Kong to learn from? If yes, what would be the expected challenges?
Yes, thank you, Herman. I think this is something that is desperately needed in Hong Kong. If you look at our elderly population, especially those who are quite frail, even when they have a minor problem, if they're homebound or bedbound, what can they do? They can only dial 999 for an ambulance to take them to A&E, because Hong Kong doctors don't do house calls. So that's why we have A&E, or so many elderly patients going there. Once you go there, and then, the doctors would admit you because they feel, well, you're already so frail, we'll keep you for observation, things like that. So a lot of the patients in hospitals actually do not need to be hospitalized. And the care given in acute wards are really not good, right? If you've been to a public hospital ward, you would know. They don't even have enough chairs for people to sit out. So you're lying in bed all the time. One studies have shown that about more than half the admissions to public hospitals in Hong Kong are so-called ambulatory care sensitive. They can be taken care of on an outpatient basis. They don't need to be admitted. So more than half, so I can cut hospital budget by 50%, and would still be okay. So what Dr. Hayter was describing is something really good. They have so-called virtual wards. So a lot of these frail patients can actually be treated or supported at home. So even if they have infections or something like that, drugs can be delivered at home and monitored, so they don't have to go to hospitals for that. So I think that is really good. And also, even for those who are institutionalized in residential homes, don't just any minor problems would take them to hospitals. That's what's happening in Hong Kong, because they have no medical staff in the nursing homes. Very few would have doctors visiting them. So, the staff would, of course, wants to take their sick patients immediately to hospitals. That was what happens during COVID as well. So I think we really need this kind of support to people in the community, as well as in residential homes. So I think this is something that would be very good for Hong Kong.
Thank you, Peter. So I think, yeah, the benefits behind is quite easy to understand, but I'm quite curious, but why we are still satisfying with our status quo? So government seems not to be proactive and responsive enough to reform the long-term care system. So are there any reasons or difficulties behind, you think?
Yes, this is really sad because this is such an urgent problem. And the situation is so bad right now, and it will get only worse. And yet there is not on the government's agenda to reform. I think if you look at the media, the pressing problem would be housing. Okay? This government's also have priorities on law and order, things like that. But maybe medical care, but not long-term care. It's not really, something that the media covers a lot. And as I pointed out, there has not been any discussions in the government circles on long-term care financing since 1998. Okay, so the problem is that government does not feel that this is a high priority. They would maybe inject a little bit more money here and there on a piecemeal basis. Okay, I'll give you a little bit of money for community care, some money for Geron tech. Maybe we would have, the voucher system and things like that. But we really need a more revolutionary reform on the whole financing and delivery system. If you look at the United States, elderly care, it's a big thing, because the elderly people, they vote. They always vote. They're a very high percentage. So no one dare touch their benefits, like Medicare is still very good and things like that. But in Hong Kong, that's not the case. So we really need to get this thing on the political agenda of government. I think it's up to civil society, politicians, and forums like this to alert the seriousness of the problem.
Thank you, Peter. I do hope that we have representatives from the government, in the crowd today, listening to the urgencies for the long-term care reform. So, the audiences are responding, and we have a lot of questions about Geron Tech and for Maira. So let me pick one. So we have one here, very interesting. This audience actually he has some tech background. So he mentioned a point that is very important in tech application is UAT, that is the user acceptance test. So he is wondering for if we promote Geron Tech for the elderly, he's quite worried that the elderly as the users may not accept all this Geron Tech. So he thinks we need more than just counsels or consultation. We actually need more actual tests with the elderly. So I remember Maira in her presentation mentioned about the Geron Tech ambassador. is this actually something try to respond to the UAT? And can you elaborate more on a question raised by this audience?
Sure. Thank you, Herman. So I think the question is great. And I think when we talk about the Geron Tech ambassadors, we're speaking more about helping suppliers to gain user feedback. And I think that is one part of it. But I think the audience member, what they're specifically asking is, why aren't we having more testing bodies or, testing sites to actually, have these Geron Tech products tested where the users can come in and use the products and see if, there can be some feedback loop as well. So it's not just creating this ambassador program or this panel where they give you some feedback, but it's also about having this test bed sites. And I think that, the good thing is we do discuss the issue of test beds in Hong Kong, and it's actually a very large issue that we need to resolve. And I think we try to look elsewhere, if they have similar problems. And in Korea, they have what they call it's a robot rehabilitation gym. And it functions in a similar way where they have a testing ground for different robots, and users can come in and try these products out and give feedback, and it kind of serves as a testing bed. And because Hong Kong is struggling with that, and we are also, we are seeing some good examples at Haven of Hope Hospital. They are just starting the initiative of, allowing products to be used among users so that they can get firsthand information. But testing bed is an issue, and it is something that we need to work on in Hong Kong, and it's something that we have also proposed in our research report, and you can look into more details regarding this issue in the report as well.
Thank you, Maira. Well, we have questions from Nepal. Well, I just did a quick search on net. Actually, Nepal right now, the percentage of age population is just 9%. But wow, after 10 years, it will increase from 9% to 18%. So it is good for a guest from Nepal also attend this summit to get prepared more in advance. So guest from Nepal, it actually has a question for both our guest speaker. The first will be for Peter. He would like to understand more about how the long-term care insurance works. He wants to know more about actually how it will get enough resources through the insurance to cover the expenses of the long-term care system. So could Peter help elaborate more on that?
Yes, long-term care insurance, there are probably two types. One is mandatory, meaning government is requiring everyone to purchase. So whether you like it or not, maybe pay would be deducted from money would be deducted from your paycheck, and then goes into a long-term care insurance funds. So that's what's happening in Japan, in Korea, and Taiwan. So a percentage, maybe like 1% of your salary would be deducted and goes into a long-term care insurance. So it's like healthcare insurance, but then it is a separate insurance that would pay for long-term care services in the event that you become disabled. And then they would assess you to see whether you're qualified. And then once you are, if you are suffering from disability, depending on the severity, then you would be entitled to different levels of benefits. So that is a mandatory long-term care insurance, which is being practiced in Japan, in Taiwan, and also now being piloted in China as well. The other type would be private. So it would be voluntary private health insurance, which is long-term care. It's like any insurance you can buy from the market. So insurance companies sometimes would have that. And then in the event you become disabled, then they would pay you either a lump sum, which would cover some of the long-term care expenses, or they would cover certain items of long-term care services up to a certain limit, maybe, because if this is private, of course, they would have to be costed. If you pay a lot of premium, of course, the benefits would be better. But unfortunately, long-term care, private long-term care, voluntary long-term care insurance, it's not popular. even in the United States, where insurance is the big thing, very small percentage of population would buy, on their own long-term care insurance. So I think the way to go is to have some kind of a public mandatory long-term care insurance, which they would deduct money from your paycheck. I think that is probably the easier way to go.
Is it because people don't feel this don't think that they will need long-term care service when they get old? So it's not like those other general insurance. Is it the reasons that's why it is quite unpopular in the United States?
Actually, insurance you need to start paying or buying when you're young, when you're not disabled, right? So insurance company would tell you that if your house is on fire, you cannot go and buy fire insurance. So when you're very old and frail and disabled, so no one will sell you that. So you need to buy when you're young. So when you're young, when you're 25, do you think that you would be disabled? So people don't think that they would be disabled. So there's no strong desire. But health insurance, maybe I would get sick. But would I become disabled and need care and all that? People don't think about it. So unless you mandate it, the take-up would be very low.
Thank you, Peter. So another question from Frank from Nepal is for Maira. He would like Maira to explain more about the voucher scheme and for the Geron tag items.
I think, so that's a really good question. So I'll actually pull up my slide to share with you guys so that I can walk you through the exact names of the vouchers as well. So, sorry about that. Can we see the slide? Yeah, okay. So if you can look at the slide, we selected the elderly healthcare voucher scheme and community care service voucher scheme as, suitable voucher schemes that can be expanded on to cover Geron products. Now, I will put a disclaimer out there. The elderly healthcare voucher scheme in Hong Kong is not considered perfect. We do have some problems with it and for various other reasons. But if, we are to continue on, building up and enhancing this scheme as well as the community care service voucher, the reason why we selected these specific scheme is basically of the objective that they want to achieve, right? So let's say we're talking about the elderly healthcare voucher scheme. This scheme is actually targeted to all the elderly across Hong Kong, and they basically are paid $2,000 every year to go and to the private sector, which is slightly more expensive, to do health checkups. But the main objective of this scheme is to try and encourage them to access primary care services and really start, taking part more in prevention because we have such a, with an aging population, we have, higher populations with higher chronic health conditions. And we think that if they do go into primary care, especially in the private sector, they may be able to manage their conditions better, especially if they are at higher risk. So that's the objective of this voucher scheme. Now, why would we select this voucher scheme for the Geron products is that if you think about it, we have a spectrum of Geron products, right? We could have an electric healthcare, electric wheelchair, we could have health monitoring devices. And if you look at the nature of these products, some of them are meant to be preventive in nature. And so they can actually encourage you to, manage your health conditions. So if you're looking at health monitoring devices, they actually do that. So if they can sort of encourage the elderly to take care after their health at home, then if they can somehow use the voucher to buy and rent the product, it's really, the strategy is really killing two birds with one stone, because not only are you being able to purchase or rent this product, but you're also, aligning with the objective of the voucher scheme to begin with. Now, on the other hand, on the right side, we have community care service voucher, and these are actually targeted specifically for those who have moderate or severe impairment among the elderly. So this isn't, not everyone gets this, a very small part, but the sum is a lot more. I won't go into too much detail about how exactly the voucher scheme would be, span out, because the details, there's a lot of details to to work through. But specifically why we chose this scheme is because it's supposed to encourage the elderly to age in place, age in the comforts of their homes, right? And as Professor Yuen pointed out, it's important that it would be nice if I could age at home at my old age, right? So if the scheme is supposed to try and encourage aging in place, and if you can have, electric wheelchairs or stair climbers where you can, any kind of device that can help improve your mobility around the house would really help in your ability to age in place and prevent premature institutionalization, right? And it also reduces the burden on the caregiver. So this voucher, because of this objective and what is trying to achieve, you have Geron products that can match up to this objective. That's the reason why we've selected the two. But by no means these are perfect vouchers, and if you study the voucher schemes in more detail, you'll see that there are a lot of things that we need to also improve on when it comes to these vouchers. Thank you.
Thank you, Maira. We have a follow-up questions from the audience. He or she is asking whether it is a good idea to give the money or the vouchers directly to caregivers to purchase some Geron products. I think the reasons behind would be sometimes we are worried that elderly people may not be familiar with the products. So instead of giving to the elderly, would it be a good idea to give the resources to caregivers to do the purchase?
That's a very tricky question. That's a very tricky question because it really depends on who the caregivers are, right? And I feel I personally would feel slightly uncomfortable with giving money to a caregiver because I feel like at the end of the day, I do also want to respect the autonomy of the elderly person in terms of getting resources from the government. And resources doesn't necessarily need to be monetary. I kind of hope that if we can give support to the caregivers in some way, that would probably be better in terms of from looking at it from thinking about the elderly as an independent person as well. But at the same time, I think that if there is the problem of someone who does suffer from moderate or severe impairment, they cannot make decisions for themselves. I think the money could be given to the Geron consultants, as I proposed, and they could be the one who can sort of they don't need to get the money, but they can be the one who can sort of walk the caregiver and the elderly through the process of gaining the Geron product. But I would be a little hesitant to give the money directly to the caregiver. But that's just my personal opinion. I don't know. I'd be open to hear anyone else's opinion on that.
Yeah, we welcome any new ideas because it is how we cope with the challenge of aging population, right? We have to constantly come up with new ideas, new approaches to try to tackle the problems. So another question for Peter. So Dr. Caroline Smith mentioned the importance of public-private collaborations governance in order to build a sustainable long-term care system. So do you think we have enough cross-sector collaboration here in Hong Kong? Would you comment on it?
Yes, I think that is something that's highly desirable. We have cross-sectorial collaboration. I think that is needed because there's the NGO sector, there's government, there's the medical sector, family, these informal carers, private nursing services and all that. So I think because there's so many players, I think we need to have a good platform to collaborate. But right now, even the public sector does not collaborate enough, as I have indicated. So you have medical people under one bureau, the labor and welfare, another bureau looking after long-term care. So I think at least in the public sector, we need to get our house in order first before we start collaborating with the private sector and all that. So I think more urgently needed and what is more feasible and would go a long way to improve care would be just to get the public sector people collaborate a bit more, like what Dr. Hayter was mentioning, try to have, more support to people's home from hospitals, and then have nursing homes also supported by the medical sector, and doctors willing to do telemedicine or house call to the elderly home. So I think the more realistic and more urgently needed thing would be to get just the public sector players integrated in one structure, and then we can, with that, then they can also start more collaboration with the other sectors.
Thank you, Peter. Wow, a lot of questions for Maira. So here is this audience. He admits that IT technology is a way out to assist elderly to have a better living situation. But he or she is also worried that actually, people elderly in Hong Kong are living in a very limited space. So would this be a problem? And also he or she is concerned about elderly users are not well equipped or do not have the knowledge to use this kind of technology. So what kind of suggestions would you have to tackle this problem?
That's a very good question, and I think that when we went out to interview a lot of the stakeholders, this is something that we were discussing. With such a densely populated place, how do you create Gerontech products? How do you use Gerontech products to begin with? And I think that's the benefit of having more local suppliers. Because back in 2017, much more years ago, we used to import our products from Japan. But when we after we saw so much momentum in the ecosystem, we started seeing more local suppliers. And the benefit of local suppliers is that they keep this problem in mind, hopefully, and with the housing issue. And also with Gerontech products, it doesn't necessarily need to be something huge, right? It can be something as small as a health monitoring device. It's a spectrum of things. So I would really encourage you to, try and visit one of the GAES exhibits that occur every year, and you'll see a lot of these devices are not that big. They do not necessarily take up that much space as well. But if we are talking about the larger devices, right, we can consider having them at daycare homes, because even if the elderly people are not necessarily, most of them are living overnight in a residential care home, they do sometimes visit the daycare centers, and these can be also potential sites where Gerontech, the larger Gerontech products can be used to tried out and used by the elderly people as well. I hope I've tried to answer that question. Thank you, Herman.
Thank you, Maira. So, okay, we have an audience. The LTC insurance is also quite popular among the crowd. So here's the question is, this audience agrees very much that LTC insurance is a long-term solutions that can help with the crisis. But he or she is also concerned about the short-term and the intermediate term. So in short term, what can the government do in response to the long-term care problems, whether it's to increase subsidized homes of NGOs or try to expand the private market to provide more care support to the elderly? So any short-term or intermediate solutions?
I think government needs, of course, to continue to increase some funding to the long-term care sector. I think that is desperately needed if you look at the waiting list and all that. Some initiatives are actually quite good. Those community care vouchers that government is currently giving, where enables the caregivers to go to people's home to receive care. I think that, of course, needs to be expanded. But again, I think this is also small scale, and it's not going to make a huge difference. I think what would make more difference would be this integration, that you start shifting some some money from the hospitals to long-term care. I think that would go a long way, because even if you, let's say, reduce hospital budget by 10%, I think that will go a long way to fund long-term care services and make a big difference. And then telemedicine is something I feel has a lot of potential here in Hong Kong, because doctors are busy and all that. But in nursing homes, even in people's homes and daycare centers, I think having this telemedicine session can probably help a lot, because then the patients don't need to go to A&E all the time for minor problems. So I think that would go a long way. If you look at the number of elderly people in A&E, I think that would help the hospitals a great deal by just having some telemedicine sessions. So I think that would be some solutions in the short term, but not really good fixes, but some quick fixes.
Thank you, Peter. So, okay, another question for Maira. So about how to engage young people to support Geron technologies. He or she likes the ideas very much, but he also, I think maybe this audience is from the social service sector. He or she shared a recent ad from an NGOs in Hong Kong's hiring a Geron tech assistant with only 10K per month. So and without a very clear career path. So how can we attract more young people to join? In support of like your suggestions.
Thank you, Herman, for the question. And I think that's a really great question. And I probably just touch on it slightly in my presentation, in the sense that, you know, the thing with talent is that if we want young people, if we want to attract people to this, you know, profession, this field of studies, we need to start taking this field of study more seriously. And we can do that indirectly through, you know, having courses on it, and show that, you know, the courses are equally important as other topics. That way we can show, okay, this is a potential area that you can explore. And this next step would be that apart from studying, we also create certification processes where they get certified, they get trained to become a Geron Tech consultant or so, something similar. And or more importantly, we formalize the career pathway. And the audience member, what they are sort of saying is they're taking it one step further, in the sense that, okay, if you have a profession, fine, but is there any sort of career ladder as the next step that I can look forward to and actually take this profession a bit more seriously? So actually, we also make a similar recommendation in our report, and we build off of the social welfare's program, and it's called the Navigation Scheme for Young Persons in Care Services. And this scheme is basically under the Social Welfare Department. It's for the young people that are joining the care service or the care economy. And it includes, you know, different people that work in nursing homes, but it's very structured. And it's made structured so that young people could see it more seriously. So if we were to consider, you know, coming up with, you know, these so-called Geron Tech consultants or this kind of profession, if we could add it to this specific scheme under SWD, that would be great, because that would then give the Geron Tech consultant a structured pathway that would help them sort of move upwards through their career ladder. So that was a great question, and I hope I could answer that to some degree. Thank you.
Thank you, So we mentioned we discussed a lot on how to address the problems, like from the government point of views, and on in quite a macro view. So, but as an individuals, and then just individuals, a normal audience of today's programs, what can we actually help and support and contribute to help Hong Kong overcome the challenges of an aging populations? So as an individual, so these questions goes to both of our guest speakers. So maybe Peter first.
As an individual, I guess we need to stay healthy. As Dr. Eagleson's pointed out, actually a lot of these investment in healthcare, in medical care, does not really make any significant difference in the health of the population. So the health of the population is that we live healthy lives, good lifestyle, we exercise, we eat right, we seek care at early stage. So I think in order to age well, we need to start young. So all the young people listening, I think they should take care of themselves, and live a healthy lifestyle. And then you would really make a difference in the old age. The quality of life and the need for premature long-term care would be much, the probability would be less. So I think healthy aging starts when you are young. So, so that is my advice for individuals.
So for Maira?
Yeah, I think for me, I think I really think about like, what is my mindset like and how it can change and try to be more positive. Because, when I work in Geron Tech, I feel slightly more hopeful about the aging population problems. But, personally, I think that I look at, where we were and how far we've come. And even back in like 2017, no one was really talking about technology when they thought about aging population, right? They only thought about, okay, let's improve beds, let's improve manpower. And these are really important support systems that we need, but sometimes they take time to build. And so seeing that technology now is more sort of accepted, or at least we are open to the idea of it, makes me a little more happy and hopeful. But me personally, I think that I always also ask myself, why do I want to work in this field of aging population? I'm not old myself, right? And so I think, and even when I talk to some of the younger audience, the thing I always say is that, investing in the aging population isn't necessarily investing in them only. It's also investing in ourselves, in our future selves, because we're going to age one day too. And I think that if we hope to age well, and investing in this field or investing in this challenge is important. But I think I would also like to end and go back to the theme of the summit, which is crisis, from COVID to change. Is it from crisis to change? Yes, from crisis to change because of the COVID pandemic. I think, inevitably, like, human behavior is to always change after a crisis occur. But I really hope that it doesn't take us another crisis for us to finally change. And we can be more proactive, and we can have more dialogues such as this to start talking about the changes that we need to make and be more proactive. Thank you.
Thank you, Maira. So the last questions, as we are running out of time. So the last question goes to Peter. So it's about any short and medium term for an elderly home in Hong Kong, because as what you have presented, there's a huge crisis for those nursing homes in the fifth wave of the pandemic. So after learning these painful lessons, what kind of short and medium term plan can these nursing homes can do in order to avoid another big crisis from happening again?
I think they are so crowded, but if you look at the statistics, maybe more than half of them actually don't need to be in homes, in residential homes. They can stay home or stay in the community. So if we reduce the population by half, I think, then suddenly we have more space. So it need not be so crowded, right? And then it's more expensive to keep people in the home. So I think the important thing is to put more money in community care so that you don't have so many people in homes. Then you can improve, you have more spacious homes. You can design homes that are probably much more effective in controlling cross-infections within the home. Even if we reduce the residential population by 50%, I think that would make a lot of difference. And then we try to improve on the living conditions in those homes. So we need to do two things. One is, of course, put more money in community and home care, so to keep people away from residential homes. And number two is that with fewer people in residential homes, then government needs to improve the environment there to make it more pleasant for the residents and more effective in controlling infections. So I think that is what is needed.
Thank you, Peter. So as we are running out of time, I'm afraid that we have to conclude the section now. So once again, we'd like to thank all our honorable keynote speakers, Dr. Caroline Smith, Dr. Karen Eccleston, Dr. Adrian Hayter, and Professor Martin Formosa, as well as our local guest speakers, Professor Peter Yuen and Ms. Maira QAMAR. Aging population will no longer be a crisis if we pool our resources and work together. So I strongly believe that through international and cross-sector collaboration, we can find our way out and embrace aging population as a gift of human success, just as what described by Dr. Caroline Smith. So thank you very much for your participation. Please spare a few seconds to complete our program survey. And don't miss out our afternoon section, which will start at 2 p.m. The theme of the section is Turning Silver into Gold, Smart Aging Innovation in Singapore. So thank you very much for your participation and see you in the afternoon. Goodbye.